Welcome to Understanding the Skilled Nursing Facility Readmission Report. With the advent of the Skilled Nursing Value-Based Purchasing Program, as well as the addition of the rehospitalization quality measure in the 5-star rating system, it's important that all nursing homes monitor their rehospitalization rate and use these data to drive their improvement efforts. These reports will help your nursing home do that. In this short video, I will explain how to interpret these reports. This is the title page of the report. You can expect to see your skilled nursing facility's name, the CMS identification number for your skilled nursing facility, your state, and the overall data time frame. The data included in this report spans patient dates from October 2014 through September 2017. Each quarter, this date range will shift. The second page of your report provides a table of contents outlining what is coming in the pages that follow. The third page shows a high-level overview of what's represented in your report. The report provides descriptive data and trends for Medicare fee-for-service patients who are discharged from hospitals to your skilled nursing facility and readmitted to a hospital within 30 days. The image at the very top shows a basic representation of that process. The data source for everything in this report is Medicare fee-for-service Part A claims data. It's important to note that this does not include Medicare Advantage patients. The next several slides will outline some details of the data you'll find in the report, which are described on this page. Data in the report are summarized by rolling years, calculated by quarters. Each time period shown contains 4 quarters worth of data. Each time period will overlap the next by 3 quarters. I'll illustrate this when we move on to the next page of the report. In the readmission rates section at the bottom of this table, you'll see descriptions of the components that go into each readmission rate. I'll first describe the denominator. The denominator is the total number of Medicare fee-for-service patients who were discharged from a hospital to your skilled nursing facility. For purposes of this report, discharged from a hospital to your skilled nursing facility means that a patient had a skilled nursing facility claim filed within 2 days of being discharged from the hospital. The numerator is the number of patients among those in the denominator who went back to the hospital for an inpatient stay within 30 days of being discharged from the hospital to the skilled nursing facility. It doesn't matter what else that patient did within the 30-day time period. They might have been discharged from your skilled nursing facility or gone to another. If a patient was discharged from a hospital and admitted to your skilled nursing facility within 2 days, and they went back to a hospital for admission within 30 days of being discharged from the hospital, they will be counted as a readmission in this report. Please also note that these readmission rates are all-cause. They are not risk-adjusted in any way, and they include both scheduled and unscheduled readmissions. This final section of the first page of the report outlines some of the detail that you'll see in the report. Readmission rates are summarized by each of these population segments. Race, age, and sex are based on Medicare enrollment data. Diagnosis primary is the primary diagnosis on the hospital claim that's the index. The index hospital claim is that hospital stay that happens immediately before the skilled nursing facility admission. The report summarizes readmission rates by several primary diagnoses, which we'll see in the following pages. Diagnosis This is the next page of the report. Chart 1 shows the readmissions from your SNF to the hospital compared to state readmission rates. The orange line is readmissions for patients who came from a hospital to your skilled nursing facility and were readmitted back to the same hospital. The blue line is for patients readmitted to any hospital, even if it was different from the one that they came from. The green line is for patients across the state. If you do not see a marker for one time period, the marker being the circle or triangle on the chart, this means that data was suppressed. We'll talk more about this on the next page. Finally, you'll notice the axes. The y-axis on the left is the readmission rate. The x-axis on the bottom is the time period. Each marker on the chart is a year's worth of data. So the first marker is data for October 2014 through September 2015. The next marker shifts forward a quarter and includes data for January 2015 through December 2015, and so forth. A note that if you're a skilled nursing facility in Wisconsin, your graph will include an additional line that shows the readmission rate for SNFs in your region. This next page of the report shows the data that feeds into the chart we just reviewed. All of this is sample data, and you'll notice that some rows say suppressed. This is for data privacy rules. Data is suppressed if there are fewer than 11 patients who were discharged from the nursing home and at least one of those patients went home prior to being readmitted. Again, note that if you are a skilled nursing facility in Wisconsin, your table will include an additional column that shows the readmission rate for SNFs in your region. Table 2 is a new addition to the reports that you would first have seen in the Quarter 2 2017 reports, which were sent out in February of 2018. This shows a summary of patients who come back to a nursing home after a hospital readmission. Any patients that were included in the readmissions column in the previous table, which was Table 1, will appear in this table in the total readmissions column. This is the denominator. In other words, patients who were discharged from a hospital admitted to your nursing home within 2 days and subsequently readmitted to a hospital are included in the denominator for this table. The next column, column 3, shows the number among those readmissions that are admitted back to your skilled nursing facility within 2 days, and the following column shows the percentage of those readmissions that were admitted back to your skilled nursing facility. The following 2 columns show the number and rate of patients who are admitted back to any skilled nursing facility within 2 days after a hospital readmission. This next page shows a picture of readmissions by day for the state for the year of data shown at the top of the chart. In this time period, you'll see that 4.5% of readmissions happen on day 1. Of those readmissions, most are back to the same hospital, shown in blue, but some are to a different hospital, shown in green. And 5% of readmissions happen on day 2. This goes all the way through 30 days. This slide shows a snapshot of the various population segments for your state. The first column shows the main category of population segment, which we reviewed on the About the Data slide. The next column shows the different groups within that category. The third column is about discharges from the hospital to the nursing homes. The N in that third column is the total number of patients that fall within that group, and the percentage in the fourth column shows you what percentage of patients that was. For example, in the first row, total, you will see that 21,388 patients are in the first column with a number. This is all patients, so that percentage is 100%. The N in the fifth column shows you what number of patients in that group were readmitted, and the final column, a percentage, shows you the readmission rate for that group. For the first row, there are 3,963 patients in this column. If we take 3,963 divided by 21,388, we get 18.5%. And this is our readmission rate for the entire time period across all patients, because this first row is total. This concludes our review of these new reports. If you have questions on the content we reviewed or on receiving your report, please contact the applicable person for your state, listed here. If you'd like to join the Nursing Home Quality Collaborative, please visit the website shown on this page. This concludes our presentation. Thank you.